y'all are getting familiar with that. We're going to come in, introduce ourselves. Hi, I'm Lainey. I'm from College of the Washtenaws. I'm going to be your student nurse today. I'm going to be assistant nurse. How are you doing today? Can you give me your name and date of birth? We're going to check our identity of our patient. I'm going to wash my hands. I have gloves on. I'm going to wash my hands. I'm going to explain my procedure to the patient. I'm going to be giving you a bed bath today. Is this a good time for you? Are you having any pain right now? Could you describe for me on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever had? Okay, because do we want to give them a bath if their pain is a 10? No, we want to come back, right? We're going to medicate them and wait till later. We're also going to ask about, do they need to use the restroom? This takes a while. This skill is going to take a good 30 minutes. So they may need to use the restroom first. They may need to have a bowel movement or urinate before we get started. So we'll take care of that. If we have older patients, they get cold very easily. They stay cold, okay? So we're going to ask, is the temperature in this room okay, or would you like me to increase the temperature, okay? So we may need to go ahead and bump up the temperature a little bit and wait for it to warm up before we begin, okay? We've already gathered those supplies. If we're ready and she's pain-free and is ready to go, I'm going to go get my water, okay? So I'm going to go get my water. I'm going to make sure it's really nice and warm. When I come back, I'm going to provide privacy. I'm going to raise my bed up, guys. Okay? You know what? Are you taping me? Okay. I need to stop right here. We're going, before I get my bath, sorry, Rachel. Before I get my bath water, I'm going to do oral care. That's the first thing I'm going to do. I don't want my water to sit here because it's going to get cold. Okay, so we're going to do oral care first. So provide privacy. We're going to put gloves on. And I'm going to raise the head of their bed. If I want to do oral care with them lying down, never. Okay? We're going to do it on a conscious patient first. If they can help us. If they can do it, we're just going to provide the stuff. Okay? So, and please offer that. No one ever offers the patient oral care anymore. So I would put a towel here to protect them. Okay? And then I'm going to have this glass of water. Take a drink for me to moisten your mouth. If you need to spit it out, you can spit it into this. Okay? So if they can do it themselves, I'm going to put the toothpaste on here and let them brush. And they're going to spit it out. I'm going to give them a cup of water to rinse. Okay? And do this until they're done. And then I'll empty this, clean this. Okay? If I need to do it, then I'm going to make sure their head of the bed is elevated, that I have suction on and available to me. It is working. Okay, I would turn their head. Okay, and I'm going to brush the crowns of their teeth. Okay, that's the tops that are visible. We're going to do this in a long motion, and then these we do in a circular motion. Okay. Okay, then I'd brush all that. Then I would use probably a syringe of normal saline, and I would rinse their mouth out and suction out with the water so that they do not aspirate. Okay? All right. So most of the time, your patients can do their own oral care. All right? If they did not have teeth, I would at least use these swabs. Okay? So I would clean really well with the swabs. All right. So we've done our oral care. If I have a male, are we still videoing? If I have a male patient, I'm going to go ahead and shave him, okay? Offer a shave. So I would first take a really hot, not too hot, make sure I check the temperature. Is this temperature okay, Mr. Hoffman? Okay. And I'm going to lay this on him and soften those hairs, okay? Leave that on there a few minutes, and then to shave him, I'm going to put the shaving lotion on him. And I'm going to go in the direction that the hair grows, okay? When we get under that chin, we're going to pull the skin taut, okay? Careful not to cut the patient, all right? And then we rinse that off really well. I just wanted to mention, I may just ask you about how would you shave a male patient, okay? All right, so let me get these things out of the way that we've talked about. Now, if I worked at a great facility that has the shower caps, like where I work, I'm going to go ahead and put the shower cap on the patient. It's really hot. It has the shampoo inside it. It stays warm while I'm giving the bath, and it has a rinseless shampoo on it. Okay, so I'm going to go ahead and put that there. All right, now I'm going to get my water ready. So I'm going to put my side rail up and say, Ms. Hoffman, I'll be right back. I'm going to go get your water, okay? And I'm still in the room. I'm just going to the sink to get my water. When I come back, I'm going to make my bath mitt. Well, I'm not even going to start that. I'm going to get her out of her gown and put her bath blanket on. Let me show you how to do this. Here is my bath blanket. They're all folded in a certain manner, guys. We're going to put it in the center of the bed. Okay? Alright? And so, if I had help, Shevin, come on and help me here. I would unroll this like this. We're not going to shake it. We don't want to shake the microorganisms all over the room. So we're going to undo it like this, and it'll roll towards you. Let me find your end. Well, this one wasn't folded correctly. I'll let a student do it, and she didn't do it right. It's okay. So you take that side, okay? Okay, and I would say, Ms. Hoffman, can you hold on to this? And this is what you'll do as patients in the bed. You're going to hold on to it like this. Okay? Can you hold on to this? And we're going to remove your linens. Okay? So we go straight down. Put my side rail up because I'm going to the bottom. Okay? Now I told you that because laundering these items are so expensive, we're going to keep her, unless it is soiled, I'm going to keep her blanket, okay? Now you can either roll it up at the end of the bed, or make sure it does not touch the floor. If it touches the floor, it is dirty and we cannot reuse it, okay? So I'm going to fold this like this, and we're going to roll that up away from you, Shevin, and we're going to put it in the hamper. If there's not one in the room, we'll place it at the foot of the bed on the floor.
Curtain, good.
So I'm going to put this over here
Anybody else?
because I'm going to use it later. Now I'm going to remove the gown while I'm holding on here, or I'm having my patient hold on. So let's remove that gown. Okay, same thing. I'm going to put this at the foot of the bed, rolling it away from me.
Right.
Okay, now I'm ready. Alright, I'm going to pull this down, and I'm going to put this behind the head because this is where I'm going to start. Okay, this is protecting their pillow and keeping them dry.
Sure they don't have to use the bathroom.
And I don't, you can stand there if you want, but I don't need you yet. Can y'all see? Okay. One time y'all are going to make a bath mitt. Okay? In the real world, I don't think you will. There's several different ways to do it.
Any possible precautions?
Depending on where you went to CNA school, you may do this fan fold thing where y'all fold back a fan. I do it the easy way where you just put it like this. Wrap it around your hand like this. And tuck it in right here, okay? And that's your bath mat. Want me to show you again, Gail?
I got it.
Okay, so we tuck it in. I just want y'all to show me one time, and the rest of the bath you can just pretend you've done it. Put it in the water, wring it out, okay? I don't want dripping, soaking wet water going on your patient. We're first going to touch the patient. Ms. Hoffman, is this a good temperature? Is that too warm or too cold? Okay, good. It was a good temperature. I'm going to start here on her face with no soap. And I'm going to go here to this eye. I'm going to turn and use a different portion of my washcloth here on this eye, okay? Now I'm going to turn this over using a different portion, and I'm going to wash the face. I can ask my patient, would you like soap on your face? Most of the time they don't like soap on their face. It's really drying and makes it itchy. So you're going to start here and go down their face, okay? Using different portions of your washcloth, all right? Come over here and you're going to rinse every portion that you wash. I just want you to say, and then I would rinse it. You don't have to do it. Just tell me. Then I would rinse it, and then I'm going to pat it dry. Okay? So we have another towel. And we don't do this. Okay? We pat dry. Pat, 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 pat. Okay? Okay. Then we're going to get our water, wring it out. We're going to do the neck. We're going to do behind the neck. Okay? We're going to come down here. Let's say this was a male. Okay, I did a female a minute ago. I would put a towel here. Okay, and I could move this down. Now in men, we can pull this down here, okay? And we can do, when we give a bath, we're trying to stimulate circulation. So we're going to do big circular motions, okay? We're going to do like this. And always towards the heart. This one has a weird thing on it where it's not letting me slide over it. But we do big circular motions, okay? And change your washcloth. Okay, rinse and pat dry. And then we can come to the abdomen and do the same thing. I would lower their head down probably a little bit so I can get to the abdomen. Same thing on the abdomen. Big circular motions on the abdomen, okay? Rinse and dry. If this were a female, let me back up. Especially Shevin, because you're a male, We want to be respectful and let them know that we're going to be touching a private body part, the breast. We're going to say, I'm going to keep you covered, but I'm going to be cleaning your breast, okay? So I'm going to go underneath here, big circular motions from the top, going down under here, rinse and dry. When we're going to do, we have to lift the breast to go underneath it. So you're going to use the back of your hand to be respectful. We're not going to grope our patients. Okay, we use the back of our hand. Tell your patient that, Shevin. Ms. Hoffman, I'm going to be lifting up your breast with the back of my hand. I'm going to be touching you, lifting that up to clean under it, okay? If you'll use the right terminology and explain to her what you're doing, she won't be offended, okay? And we're going to clean under there. This is a good assessment time, ladies and gentlemen, especially if you have a big-breasted patient. A lot of times they'll have yeast under there. They may have medication already for it, ordered for it. So after you wash and dry this area, it'd be a good time to go ahead and put it there. Or maybe you're the one who found it. So now you need to go tell the nurse after you've completed your bath. I noticed when I was bathing Miss Hoffman, she has yeast. So we need to get the doctor to order her some medication for it, okay? A lot of larger patients may have yeast under every fold, okay? In the groin, under every fat roll, under the breast. Okay. Sometimes old, large-breasted women may just want powder, okay? You could offer them powder at this time, or we can wait until we're completely done with our bath and then offer the lotion, the powder, and the deodorant then, okay? Okay, so after we have done this part and dried it, cover them back up. I said in the first video, or the first time I showed this, it doesn't matter to me if you do the chest and abdomen first, or if you do the arm, as long as you're going from clean to dirty. Just don't do the feet and then the head, or the bottom and then the head, okay? As long as you're going from clean to dirty, I'm okay with whatever manner you're doing it in. Now, I'm going to move to the arm. So I'm going to move this out from under their head and put this under their arm lengthwise. Are you still doing okay, Ms. Hoffman? Check in with your patient. Make sure they're still okay. You're not having any pain, are you? Okay. So you don't have to do your bathroom anymore. Get this ready. Is the temperature still okay? Okay. All right, so like I said, we're trying to stimulate circulation or promote circulation. So I'm going to always do big movements up towards the heart. Okay, up, up, up. Okay, rinse and dry. And here I'm going to always supporting the joints. Go up, 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 up. I would do the axilla, which is the armpit. Go under the armpit. Then I'm done with that washcloth. Okay, that's a dirty area. Okay, I don't have to change my water, but I'm done with that washcloth. So rinse and then pat dry. Pat, pat, pat. Okay. On the hand, you can, and y'all, when you have time as a nursing student, please offer to do this. They love having their hands and their feet soaked. You could be soaking, while you're washing their arm, you could be soaking their hand. Okay. So that gets all the cuticles really soft and gets all that dirt underneath their fingernails out easier. So then you would take that out, make sure it's on that towel, hold your hand up. And like I said, we're always going towards the heart, okay, wash all that. We're going to go in between each finger carefully, really carefully, and then we would use what we call an orange stick. Have y'all seen one? It goes underneath the fingernails, on the fingernails only, not the toenails, okay? We would clean under those really well with our orange stick, okay? Make sure that's dry. All right. I'm going to cover my patient. Remove that wet towel. It's getting wet now, so I may need to switch towels, okay? Put your side rail up. We're going to move down a little bit. Now I'm going to go to the leg. I'm only uncovering the body part that I'm cleaning, remember? Put this lengthwise under your legs, supporting the joints, okay? Bend your patient's leg up, if they can. Okay? And same thing. You can start here if you would like, here or here, going in that upward fashion. Up. We're not doing the groin yet, okay? We're not doing the perineal area, we're just doing the leg. Up, 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 okay? Turn that over, or you may need to go ahead and rinse it and repeat. And again, up, up, up. I just want you to tell me. And I would wash this area, rinse this area, dry this area, pat it dry, okay? When we get to the feet, same thing. We might want to soak the feet if we have time, okay? Now, I know I'm repeating myself. I can't remember which group I've said it to. When you give a bath, it is the best assessment tool ever because you're looking at every inch of their body, especially when you get to the feet, when you're elderly patients that have circulatory problems or your diabetic patients, we've got to really examine their feet well, okay? So, when we wash here, we're going to gently do it. Examine the heels underneath the toes really well. Do not take your washcloth and do this, okay? Do not do that. If your patient is a bad diabetic, we can tear that skin off and cause an ulcer. We're going to do it very carefully, gently between each toe, okay? Look in between each toe. You'd be surprised how many ulcers have started in between the toes, okay? All right, so gently do that. Dry the feet really well, okay, especially in between the toes, because bacteria gets in there, okay? Lee brought this up in the last session. Some people's toes are already, they may have hammer toe, so we don't try to pry those apart, okay? We do the best we can to get in between them, but do not try to pry them apart. You could break some bones, okay? Okay, so after the feet, we're going to change our water at this point. So I'll make sure my side rail's up. I'm going to rinse and dry this, remove these, cover my patient back up for warmth, and I'm going to change my water. I'll be right back. I'm just going to the sink to get some new water, okay? And I go get some more water, about this much. So, have I said it already when we're changing the water? After the feet, the seat, and any time it's cold or cloudy. Can y'all remember that? So after we do the feet, we change it. After we do this area, we change it. And anytime it's cold or cloudy. So I've come back with my fresh water. What's the first thing I'm going to do say to my patient?
This is very important.
That's right. We're going to touch it again. Ms. Hoffman, is this temperature okay? I've got some fresh water. It's good? Okay. Now we're going to do the female perineal area first. All right, what position do you think I'm going to put her in? Dorso recumbent. That is correct. Now, the book shows that we provide privacy, okay, and we put her in this position and leave this back blanket like this. But because I'm showing you this, I'm going to move it out of the way, okay? All right, I'm going to put this towel underneath her. Okay, hands right there. Okay, so on a female client, always tell them that you're about to touch them. Have your washcloth ready. We're going to use a different portion of our washcloth every time we clean an area, okay? Ms. Huffman, I'm about to touch you, okay? I'm going to do the outer, the major labia majora first. I'm sorry, this afternoon I can't get my words. Okay, I'm going to do the side that's away from me first. Okay, so I'm going to start there. I'm going to go down, turn my washcloth, come down, open, and do the inside, the inner majora, the minora. That's the inside. I'm going to go straight down, turn my washcloth, go straight down. The last swipe I'm going to make, I'm going to turn my washcloth one last time and go straight down the middle towards the anus. Okay? Then guess what I'm going to do? Rinse and dry. Dry really well. Why do I need to dry this area well?
The best thing you can do is
moist, warm. That's right. Yeast and bacteria. So dry this area really well. And then, do I change my water here? Yes, we're going to change our water again. We've patted her dry, cover her back up. We're going to change our water, and then we're ready to go to the back side. But first, let me show you how we would do a male. Okay, if we were doing a male, we put the legs down together, like this, and we put the towel on top of their legs, okay? I'm going to show you two types. And guys, when you check off, I'll have you do one body part and ask you questions about the other body part, okay? Let me move this out of my way. I'm going to start with a circumcised male, okay? So I would hold it firmly in one hand. Hold the shaft of the penis in one hand. I'm going to start with my washcloth in a circulatory manner and going in a circulatory manner over the head. Then I'm going to go down the shaft, down, down, down. Turn my washcloth, go down the scrotal area, okay? And then lastly, with the back of my hand, lift the scrotal area and do a swipe. Okay, and that's how, and then I would rinse in the same manner and dry, okay? If this is an uncircumcised male, I have to pull the foreskin back. Do y'all know about, okay. So you pull the foreskin back. We never force the foreskin back. If it doesn't come back, the first thing we're going to do is put it really warm, wet washcloth over it for a few minutes to see if that loosens it, okay?
As you brush their teeth.
Then we'll try again. If it doesn't, we never force it back. You can tear their skin and cause trauma. So you would just stop there and tell the RN or the doctor, okay? There's instruments that have to be used sometimes. You know, even your babies. Have y'all had a child whose foreskin grew back after they had that wasn't medicated or kept moist after they had their circumcision, it'll grow back. So they have to use a surgical instrument to tear the skin, okay? So when you pull that back, you do the same, you clean it the same way as the uncircumcised, do the circular manner around the head, down the shaft, down the scrotum, lift it and do under the scrotal area. But then you put the foreskin back. After you dry it, put the foreskin back. Don't leave it down, or then the penis could swell and the foreskin will not go back over it, okay? Then we got a problem. So make sure you do that. I always say, put things back like you found them, okay? Okay, so now we've got the body parts taken care of, all right? Now, let me say this about that. When we get to the private areas, we always want to ask our patient if they would like to do it themselves. Some people cannot do it or can't reach, want you to do it, but some prefer to do their private areas themselves. So please don't forget to offer and instruct them how to do it correctly though. Make sure they're not wiping from back to front if they're female, okay? So that they're spreading infection. Okay, now I'll use you again, Shevin. Okay, now Ms. Hoffman, I'm ready to do your back, okay? So I'm going to leave your side rail up while we turn her, just so that she's safe. And I'm going to turn you on your side, okay? Now, when we get to this point on your patients, if they have any respiratory problems, we need to do this swiftly. We may not be able to lay them completely flat. Sometimes we can take their pillow away from them, but if they're having respiratory problems, we're going to leave it, okay? So now I'm going to turn. Okay, can you turn and reach that rail over there? And I'm going to keep you covered as you turn, okay? So we're going to turn the patient, okay? And that's why we do the back and the bottom last, guys, so y'all can change their bed. Alright, so this is why it's good to have that second person. I'm going to move him back towards me so I can reach him. Okay, I'm going to put my towel long ways. And I'm going to just uncover the back.
With some warm water in it.
Alright, this again is a great assessment tool. Can you see me, Rachel?
You'll take a wet washcloth that's warm.
Alright, I'm going to have, let me back up and say this. After I do my peri-care, whether it's a male or a female, I'm going to change my water. Not only am I going to change my water, I'm going to change my gloves. Okay, that is the dirtiest part of the body, so we change the water and our gloves. So I've come back with my new water, my new gloves, and I'm first going to test.
You wouldn't reuse those.
Ms. Hoffman, I've got some new water. Is this temperature okay? Yes? Okay, good. So I'm going to do this in back and to stimulate circulation. I'm going to do big motions, okay? Big motions up the back. If it's dirty and you see it's dirty, turn it over. Going up towards the heart, always, okay? Alright, so we would rinse and pat this area dry. Great assessment time. Looking at this back to see if there's any breakdown anywhere. When I'm doing the buttocks, we're not doing the anus yet, okay? I would have my washcloth. I'm going to do big strokes out, okay? I'm looking for any breakdown, any redness. If there is redness, put your finger on it and do an indentation. If it stays red, they already have stage 1 breakdown, okay? We do not massage that. So we'll be careful about cleaning that area. If we massage it when they're already in stage 1, we further the breakdown, okay? So don't do it. Alright, and then we're going to rinse and dry this area. Lastly, with a new washcloth, we're going to do the anus, okay? So again, we're going to tell our patient, I'm going to be touching your bottom. I'm going to clean your rectal area, okay? I'm going to assess this area to make sure they don't have any internal or external hemorrhoids. Y'all know what those are? Okay? If they have any fissures, which means they have tears, anything like that down here, that's a good assessment time. So I'm going to start from front and go back. I'm going to change my washcloth, do it again. I'm going to continue to use a different portion until it's clean, just like when you go to the restroom. We're going to do it till it's clean. I'm going to make sure I rinse that area well and dry it really well, okay? If they had hemorrhoids or any kind of fissures, tears, any medication that needs to go in this area, I would apply it at this time, okay? I could also, if the patient wanted a back massage or if they wanted lotion, I would go ahead and apply it now, okay? Now I'm ready. Let me get all my bath towels out of the way. We'll clean this up in a moment.
That doesn't necessarily mean
now,
be going like you
I'm going to start changing my bed, okay?
Or they could be weird like me.
Okay, I'm going to move the pillow towards you and you're going to stay right there.
Some of it grows in
So
circles.
I'm going to start with removing the dirty linen.
Very difficult.
I'm going to roll it up as close as I can to my patient,
Along the jawline.
okay? Are you
That's
still
your,
okay, Ms.
that's your
Hoffman?
knock
We're gonna
out.
hurry, okay?
So, people that we're
Just
not
a
gonna
few more
shave,
minutes if you
who are
can
they?
handle it. I put my blanket on top of my stuff.
Within reason, you know.
So I'm gonna lay
some-
this
some
out and it
diabetics,
should
it's
just
okay to shave.
unfold, guys.
It's pretty safe though to say no.
And I'm gonna try to do this quickly
You get a
because
doctor order to shave.
they don't like laying in this position, or maybe
Probably
they're short of
safest
breath.
thing to get an order
Maybe
to
this
shave.
sheet will fit this bed, the last one did
To be
not.
honest, we're not gonna shave.
I wanna make sure my clean isn't touching my dirty,
That was actually
okay?
an influx question that I had on my
Next
notes.
is my draw sheet. I try to go from shoulder to knee, but I can tell you that we really do shorten them to about from here right under their buttock area, okay?
Wound.
But it's supposed to go from shoulder to knee.
If they have.
That folds inside the new sheet,
severe skin
okay?
breakdown on their face,
And y'all will just get in here and practice this yourself. Get with the CNA. They're very good
you
at
just
it.
let it go.
Okay, put my side rail back.
Let it go and keep it clean.
Okay, Ms. Hoffman,
Keep it as dry
I'm gonna
as
have you
can.
roll over
Shave it when it
these
gets
new
wet.
sheets, okay? We're gonna get the dirty sheet out from under you, okay? You ready?
With Coto,
Right, so you're gonna help me roll her
and shaving.
over, keeping her
You
covered.
always have to take that into
We're
consideration.
gonna remove,
Muzzle.
okay,
They don't
we're
shave.
gonna remove the dirty first,
Women
okay?
don't believe in shaving,
I've got you.
so.
We're gonna let
some
you lay
women
back
will
just a
shave.
moment.
Women with cushions, they will
You
get
go ahead and
full
move the
work
pillow
here.
out of the way. Just put it right there on the,
It's okay
right
to
there.
shave them, I mean, it really
Kinda,
is.
yeah.
But just ask, just ask, and you can't assume that everyone with a beard.
Good.
wants to be
You
shaved.
see how he's
Some of
rolling
them,
that up?
they
That's
just-
great.
They just want it. Or they just don't want to be
Still
shaved.
doing okay, Ms.
They-
Hoffman?
you
We're
ask them,
almost done.
Do you normally keep a mustache? That's important. Because if
Okay,
our family